is Live with Miami Community News, and our guest today is the Honorable Colonel Hartley, Jr. with CHI. So, Colonel, welcome, and thank you for being here.
Well, thank you for the invitation.
And CHI serves a lot of folks, and what I'd like to do in South Florida, all right? And I'd like to first start about what was the reason that CHI first got started? Why don't you tell us about that?
Well, during that time, in the 60s and early 70s, the farm worker community, as well as blacks in the South Dade community, could not get service at James Archer Smith Hospital in Homestead, nor at Coral Reef Hospital. And so they had to go all the way to Jackson Memorial Hospital to get service.
When in the 60s was this?
Well,
more or less.
Our organization was formed in 1971. So it was late 60s that this came to, well, you know, it began much earlier, obviously.
Yes. Mm-hmm. So in 71, Community Health of South Florida was created to provide health care. But let's go back to, so the farm workers and African Americans down south had to go to Jackson.
Yes.
Right. And quite frankly, I remember these type of things. My father used to have a radio show in the early 60s called the Gospel Hour on WMIE and WUDR. Yes. And so I was in high school then. I know it's hard to imagine, but so I became acutely aware of that conversation, although I didn't see that, but you obviously saw that was going on. So tell us about who is some of the people that got involved that created this awareness that led to the formation of Community Health.
Well, of course, Doris Eisen was a key person. She was a community activist, a farm worker with a fourth grade education. And so she said, I'm tired of these children dying on the way to Jackson Memorial Hospital. And that was the impetus to get something done in South Miami-Dade County to serve the farm worker community, which was, of course, Bahamian and Mexican primarily. And they could not get services at James Archer Smith Hospital in Homestead or Coral Reef Hospital. And so consequently, people had to go all the way to Maine Jackson in order to get services.
And how far is that?
That's really about 40 miles.
That's quite a trip.
Yes. And of course, we didn't have the turnpike during that time. It was US 1 that they had travel. And they did travel that distance. And some people did die on the way to Jackson Memorial Hospital because they couldn't get service.
Plus it wasn't right and it wasn't fair. And then it was wrong.
Right.
To be able to do that. So CHI gets formed in the early 70s.
Yes.
Right. So let's go forward to when you came aboard, which was in the mid 80s.
Yeah, I came to CHI in May of 1984. 14th of May was my first day of work at CHI.
So you have an anniversary coming up pretty soon in the next couple of months.
The future.
All right. And when you started there, what were how many locations were there, and what type of medical and social services did CHI provide?
When I arrived, we had two centers: the Doris Eisen Center on Southwest 216th Street, and we had the Martin Luther King Jr. Clinica Campesina in Homestead on 810 West Maury Street. We also had outreach programs into the farm worker communities. During that time, we used to call them labor camps, farm worker labor camps. That's verboten now. We don't use labor camps. But anyway, we had services in a trailer in the Everglades Community Center. And we also had a trailer in the South Dade Farm Worker Community Center.
That's incredible that when you think back in my lifetime that there were people that were excluded from the system.
Yes.
And most recently, we see that the county commission now has 5 African Americans on the commission, and we see the big push for trying to equalize things. So you were 30 years ahead or 40 years ahead on that. So some locations where you provide medical services, let me see if I have this right. I know you know them by heart. In Cutler Bay, Hope 2 in Homestead, 1 in South Dade, Coconut Grove, is that under construction?
Coconut Grove, we were closing that for repair, expansion. We're waiting on the permit now from the city in order to begin construction.
And you have a location right on Sunset Drive here in South Miami?
In South Miami.
You mentioned about Everglades Health, which is for you guys from up north, 376th Street.
Right.
Which is quite a ways down. You have one in Tavernier.
Tavernier.
Marathon.
Marathon.
West Perrine. West Kendall, Naranja, and mobile,
Right.
and you have school programs.
We have 35 schools with school-based systems.
CHI is like it's huge.
Yes, it is.
It is a massive health provider. So other than physical health, all right, dentistry and the body, what other type of services can somebody get at CHI?
Okay. Well, of course, we have behavioral health care services with psychiatrists and psychologists, licensed clinical social workers, providing service in the community. We have a adult crisis stabilization unit now, which we've had for many years. When people are Baker Act by the police, they can be brought in because we help them overcome whatever crisis they may be experiencing, and then we can follow them on an outpatient basis after they've overcome the crisis.
Right.
But what we find at this particular time is that we don't have a facility for children. And what happens now is that the police will Baker Act a child and they'll bring him to us because we are a receiving facility. Then we have to assess that child and find a bed for that child somewhere else in the community, in Miami-Dade County, usually. But sometimes we have to go as far as Broward County to find a bed for that child. And that's difficult for the child, it's difficult for the family. And we have been promising the people in the South Dade community that we were going to get a children's crisis center. And I'm pleased to tell you that today we have begun construction of a children's crisis center in South Miami-Dade County.
That is wonderful. I know 10 years or so ago that I heard that conversation.
Absolutely. We've been working on this for a long time and raising money for it.
So when a child is in crisis and they get Baker Act up until even now, when you say you had to find a bed for them, you mean in a regular hospital or in a psychiatric hospital?
In a psychiatric facility. It may be a children's center up at Citrix, a mental health center,
Yes.
or it may be some other hospital such as Nicholas for children. But we have to find a bed for that child because we don't have the facilities or the staff to service that child.
And so we wonder quite often how a parent or a guardian navigates through this healthcare system. And it's virtually impossible for somebody, unless they know what to do. So somebody could call CHI and say, listen, here's a problem that I'm having, all right? And you can help direct them and get them the care
absolutely.
that they need.
We have staff who are available to them. And in fact, we'll sign them up for insurance plans.
Oh, very nice. Oh, when they walk in.
Yes.
That's terrific. And how many healthcare providers work directly or indirectly with community health?
Well, when we said healthcare providers, we are talking about physicians, physician assistants, ARNPs. When we look at that total picture, we're talking about 150 staff.
No kidding.
Mhm.
Okay, so there's a nurse practitioners.
But we have nurse practitioners. But of course, you know, the nurses themselves, RNs and LPNs,
Yes.
and medical assistants. So that number goes up when we start including all of those staff.
Yes, and so
Because we have over 700 employees at CHI now.
so if somebody needed healthcare and they have no money, they can call you.
We have universal access.
Okay,
Anyone can come into our facilities and receive service.
you hear that? Anyone can go to CHI. All right, and they can get healthcare services.
Absolutely.
It's so nice to hear that, because so often that people feel they feel embarrassed, or they don't have any money, so that therefore they don't seek care.
They don't seek care, and that's tragic because many of them end up going to a hospital emergency room to get what could be taken care of in a primary care environment.
And we as citizens of Miami-Dade County, when somebody walks into an emergency room when they could go to CHI or a provider, the cost is huge, and that comes right back to the people that live in the community.
Absolutely. We don't realize the cost to the community and to government when these people end up in an emergency room. Maybe they waited till their condition has gotten so acute that they have to be admitted to the hospital. And they could have avoided that admission if they'd gone to a primary care facility.
I know lots of people don't like to go to dentists. They wait till the pain is terrible. All right, that's pretty common, I suspect.
Yes.
That's when people usually go. On the other hand, I go frequently because I know what's around the corner.
Right.
If I don't do that. So, is there a dental health care?
We have dental health at our facilities as well. We have dentists and dental hygienists and dental assistants there to provide that care.
So let's talk about single men over the age of 55 that have healthcare issues. What motivates them to go to the doctor?
That's a very good question, because many times males, we don't want to go to the doctor. Macho. Yes.
So the spouses historically get the husbands. I'm not sure if it's the other way around. You got to go. You got to go. You got to go.
Yes.
And so at that point, they're having some issues, but most of the time, you provide cardiac care, general care. If somebody needs physicals for schools.
Oh, absolutely. We do physical to school. Matter of fact, each year before school begins, we have a school physical day, and at all of our facilities to provide physical. But other than that school physical day, we can do physicals at any time. Mm-hmm.
I was over at your website taking a look at it. It's a pretty thorough website. It has all the locations that are there with the hours that are open, contact information that's there. Let's just go over again. So you have a mobile van that goes around. What is typically in normal times, where does that van go and what causes it to go into those areas?
Yeah, we brought on the medical mobile van to really provide services at the public housing facilities in South Miami-Dade County. And of course, that mobile medical van is going out, and usually on Friday, they go to some homeless location. It may be under a bridge or someplace, or sometimes it's at the Homestead Soups Kitchen, and they'll go there to take care of the homeless people in South Miami-Dade County.
So often we people modestly affluent ignore or don't want to see or don't want to know that that's really going on, that we close our eyes to that's necessary. What caused you originally in the 80s to say, I want to be involved in this?
Well, I had a military career.
Is that why we call you the Colonel?
Yes. I had 26 years of service in the Army Medical Service Corps. And I retired from the Army in 1983, 1st of January of 1983. I came back from Germany in December on terminal leave and retired the 1st of January, 83. And I went to work almost immediately at Florida A&M University as Assistant Dean in the School of Allied Health Sciences. And one day I got a call from the chairman of the board of CHI, Odell Johns.
Odell Johns, 216th Street. My brother's former bondsman. There you go, Grant. I got it in.
And I had known him from my time in college, and he and I played in the band. Of course, he's about 3 years ahead of me, but he remembered me from that. And he called me, and he had seen in the alumni news that I was at Florida A&M. And he called and wanted me to help him find an executive director of CHI. And if you know Odell Johns, that was a long conversation. And finally,
he was a great bondsman.
And finally, I said to him, I may be interested myself.
So when he called you, do you think he had that in mind?
I don't think so. I don't think so.
So you'd only been out of the service a few months.
I'd been out a year and a half.
Yeah. Mm-hmm. And then you got the call from Odell Johns, chairman of Community Health of South Florida, and tells you, help. Let's go find somebody that can run this, because he was leaving at that point.
Who?
Odell. He was again looking for somebody to run the organization.
Right. He was chairman of the board.
Yeah, chairman. Okay.
And he remained chairman while I was.
So he goes, okay. And then you told him, okay, I might be interested.
And I told him I might be interested. Came down. I went through an interview, and I'm told that they had 125 applicants for the job. I was hired.
So what was it like then when he said, we're looking for somebody, will you help us find somebody? How long did it take before you went, even in the recesses of your mind, before you went, ding, that might be for me? How long did that take?
Well, as you know, that during the conversation, I said I might be interested. And shortly thereafter, I came down for interview.
So when you told him that, did you have this excitement, or was it like, oh, maybe I'll apply? What did you feel it inside?
No, frankly, I did not know about community health centers at that time. So this was new to me, but I saw it as an opportunity to serve the community, and that's what I enjoy doing. Of course, obviously, I was in the Army Medical Service Corps, and I had been this executive officer of Army Hospital, so I had experience in healthcare activities.
So you've been serving the community for decades. That's what your life is.
Yes, absolutely.
So that's wonderful to have that conversation, and for you to must feel very fulfilled with your career choices.
Oh, absolutely. It's not going to work. It's going to have fun. Every day is a fun day at CHI.
So at that point, when you joined in 1984, CHI was a small organization.
Absolutely.
Right?
Mm-hmm.
How did you and the board there figure out, hey, we need to keep doing this, all right? We need to continue providing care all the way from South Miami and Coconut Grove all the way to the Keys and to the Everglades.
And we will soon be in Key West. We hope to open a health center in Bahama Village in June of this year.
So, and tell us why somebody would choose to go to CHI versus some other facility.
Well, I think when people get to know CHI, they become familiar with our record. If they have a family member who has received service, or they have a friend who has received service, the experience is outstanding. And so they go back and they tell their friends, and their friends want service. We like to really get greater input to the community, and we work on that. And of course, we have a VP for communication who's putting that information out all the time for us to let the community know what services we provide and how they can access those services, and the fact that we are providing quality service. Because we are providing care to poor people doesn't mean that we are providing poor service, because we are accredited by the Joint Commission. We have received quality awards from the HRSA, and we have received recognition as a patient-centered medical home. And I can go on and on about the awards that we have received. But we are a quality facility.
So one of the great things you have is that mobile health van. Then when it goes out, because it's like having stuff delivered to you. Here you are. Come on. It's right down the street. Now, somebody else in the South Miami community that's devoted her life to caring for people is Dr. Tina Carroll Scott over here at the Children's Center here in South Miami. When she first took that job, it must be 10 or 15 years ago that she took that job. I said, why would somebody do that, right? And trade in a top position as a pediatrician, because it's a calling.
Oh, it's a calling, yes.
Yes. Mm-hmm. And so there are certainly, you have people on your board that it's a calling for them to do, to be able to provide.
Because it's a volunteer board.
So because people want to make a difference.
Yeah,
right?
Yes.
And
they don't get paid to come to a meeting every month, and perhaps a committee meeting also that month to govern CHI.
So one of the things that we're seeing that is happening is that even though that people of color and people that are not affluent, the healthcare it's better today than it was 25 years ago because of you and your organization and people like you across the country. It's so great to hear and to see that. One of the things that we know for sure is that the South Dade end of the county, like from here south, all right,
yes,
has been left out so many times, all right?
Yes.
And you can have all sorts of arguments, but at the end of the day, it is what it is, all right? But because you're there and you're providing that care in a place, again, like Coconut Grove, and in West Kendall, you have a beautiful facility,
yes,
all right?
Yes.
And Sunset Drive is right around the corner from here, and it's a wonderful facility. And we look forward to you many more years, Colonel. Many more years.
I am transitioning as we speak.
So you've really made a big impact, all right? And the position of CHI compared to 15 years ago is really significantly improved.
Oh, absolutely.
As is, by the way, Jackson Hospital. 10 years ago, it's like, well, only poor people go there. I said, if you need a transplant, folks, That's where you're going.
That's where you go.
You're not going to the local hospital. You're going to go. And finally, under the leadership of the county, and for you, the healthcare has been higher up on the level of being able to provide services. So let's look down the road for a couple of years. Tell us about what CHI is going to look like in a couple of years from now.
Well, we're always in a growth mode, and we really had a spurt in growth after Hurricane Andrew, and we refer to it now as St. Andrew, because after Hurricane Andrew, we were able to put permanent facilities in the Everglades camp, the South Dade camp, the Ranger, and we opened up, of course, in West Perrine. And so we have continued that growth through the Bureau of Primary Healthcare out of HRSA. And so frequently they will send out an RFP for a new access point. And then we are able to compete to open up a new facility. And that's how we opened up in West Kendall, and we opened up in Marathon and Tavernier. And so we're always looking for those opportunities to expand and to increase our service, not only in terms of sites or facilities, but also to increase the services that are available.
Yes.
So we have a comprehensive array of services that people can receive when they come in, including family medicine, pediatrics, OBGYN. Our OBGYN physicians and nurse midwives deliver at the Jackson South Hospital. And then, of course, as I mentioned, we have pharmacy and we have dental, behavioral health. We have a full array of services.
You're very comfortable with all this medical and health conversation, by the way. So Diana Ralston says, incredible organization, for our community. Diana, hi, how are you? You know her, of course. So when I was in the South Miami medical office over there, and for you folks that think that it's something, that's odd, it's not. It's a regular doctor's office.
Yes.
All right?
Yes.
And I saw some photographs of your one in West Kendall. It's 135th Avenue and about 135th
Right.
Street, right? That's
Right.
that's sort of near the airport, is it?
Right near Miami Airport.
Right.
Mhm.
And that happens to be in a shopping center, if I remember right.
Well,
Or
it's
is it-
just adjacent to the shopping center. Mhm.
And to give our viewers an idea as far as the square footage, how many square feet is that particular office, more or less?
That particular office is a 2-story facility, and we have about 8,000 square feet of floor space in that building.
8,000 feet. That is incredible. All right. And so the patients that go to CHI, are those historically just the neighborhood patients, the ones that live within a certain distance from there?
Yeah, but we have a transportation system. We have vans that pick them up at their homes and take them to the center. So all they need to do is call or let us know they need transportation.
And you'll go pick them up.
We go pick them up and take them home.
All right. You pick them up, you bring them to the healthcare facility. They don't have to have insurance while you're there. You're going to work something out with them, all right, and
Yeah.
provide care. And they can go there for their regular checkups.
Absolutely.
They like it. Hey, this is great. It's around the corner,
Right.
right? And as far as your mobile vans, it's one van that goes around?
We have one mobile medical van, but we also have a dental trailer as well that go out to provide dental services.
And they go into the trailer and you get your teeth worked on.
Right.
Susan, I'm never going to have to drive again. I'm going to. It's really incredible, and it's certainly one of the gems of Miami-Dade County and now in Monroe County to be able to do that. Under your guidance and your team, you're there in 1984. Let's go again. How many physical facilities were there in 1984?
We had 2 health centers, that's permanent facilities, and we had trailers out in the farm worker community.
Okay. And now how many facilities are there?
We now have 11, soon to be 12 facilities, and we're going to relocate from Tavernier to Key Largo. We have bought a facility in Key Largo, which is under renovation as we speak, and we'll be moving from Tavernier to Key Largo.
And again, so if somebody's having social, emotional problems, they can call you. If they're having physical problems, they can call you. If they're having dental issues, hearing issues, my wife says I can't.
Holistic care.
Everything that is there. How many patients a year, more or less, do you serve?
Well, we have approximately 80,000 patients that we serve on an annual basis. That includes about 279 patient visits.
Just an incredible
279,000
Yes.
patient visits.
It's just incredible that it goes on right now underneath most people's visions. So they don't see that. What they think about is the local hospital facility.
Yes.
There's one major hospital in town. They have 100 locations, all right, throughout the county. Most of us only know the one location.
Yes.
Right. And, you know, my hat's off to you and your team to be able to do that. I come from a medical background. I used to be a registered nurse a long time ago.
Okay. Mm-hmm.
And so I have an affinity for this and can occasionally grasp, you know, the challenges that are facing us here in Miami-Dade County. So again, let's look down the road a couple of years, and CHI is going to continue to grow. But are there some other services that you think that CHI would like to start to handle?
Well, we have talked about the future, and we have looked at opportunity to maybe do some physical therapy. That hasn't materialized yet, but that's still a possibility. I think there's some other things that we possibly could do because there's a need, and we'll see an increasing need for home care. We need to have a visiting nurse that can go out and see patients in their homes. I was just made aware of a case in our community just over this weekend. Patient is on dialysis, and he's having problem getting to dialysis. So these are services that we need to take a look at and be able to provide. Although we are concerned with primary care. That's our specialty.
Yes.
Primary care is our specialty.
So I used to do home health care.
Mm-hmm.
I'll tell you what, you'll learn a lot when you go into somebody's home. All right.
Yeah.
And you can see how they're functioning, what their support system is,
Exactly.
how they can really get around. All right. There was a lady that I knew, she was 85. I get a call. You got to come help me, Michael. It was a hoarder house. All right. And she gets released from the hospital. And it was terrible. I picked up the phone and called her 60-year-old son who lives in Miami. I started screaming at him because I've known this lady for 50 years. And he kept saying, oh, she doesn't need my help. I said, I'm telling you, I am here. She needs your help. Mm-hmm. All right. It is dangerous. So that's one of the advantages of getting into a home and be able to talk to them. Colonel, there's some young man or some young woman that's thinking about the future and thinking about their careers. And you've spent decades in serving in the armed services and in health care. Would you talk to people in that camera right there about their future? That young man or woman that's looking right now, looking at you?
Well, the health industry is an opportunity for service. And I don't care what your desire is in terms of profession but you can do whatever you want to do in the health industry. If you like accounting, you can do accounting in the health industry. If you want to be a nurse, a physician, we know that. But sometimes we don't recognize all of the other opportunities that are available in the health industry. And health is a growth industry. We're going to be needing health, yes. and especially as people get older like me, we need more health care services. So the opportunities are abundant. And, I get a student each year, an intern for a summer internship with me from Florida A&M University in healthcare management. And I've been doing this now for 36 years. And so they have left and gone out into the world in healthcare. Some of them remained in healthcare. Some of them went into other areas. But the opportunity is almost unlimited if you desire to serve. Now, if you want to go into banking so you can make more money, or in health insurance so you can make more money, but you will not have the satisfaction of service that you find in our healthcare facilities.
Well, you bring up a really good point that in the industry, you could have direct patient care and you have all the allied things that really support that moment.
Right.
When the doctor, the nurse, or whoever
right.
it is, physical therapist is with the patient. There are dozens of people behind each one of those, starting from the receptionist all the way through. And I'm touched by your humanity and for the efforts that you've done over your entire life. So
Thank you.
my many thanks to you and the community. Thanks you for being a great role model and a great mentor. And thank you very much, Colonel.
Thank you so much for having me.
Okay,
Appreciate it.
and we're going to sign off here again. This is Live with Miami's Community News, and you can find out everything about community health of South Florida online. And you can even one day, I'll bet, if you go down there or if you want to have a conversation with the Colonel, feel free to call him. I won't give out your phone number, all right? But I'd be glad to sit down with you, I'm sure, for you young people that would like to get into the healthcare industry. Again, this is Live with Miami's Community News. Folks, have a great day.